All right, this pandemic and our quarantines are taking a mental toll on almost everyone in some way. Today is World Suicide Prevention Day, and it's a very important topic in these times. Joining us to talk about that is Dr. John Santopietro, Physician-in-Chief of Hartford Healthcare's Behavioral Health Network. Doctor, welcome. Today is
Thanks for having me, Lisa.
Thanks for being here. Today is World Suicide Prevention Day. How has COVID impacted the numbers and the statistics so far this year?
Well, it's great to be with you on this day, and it's great to call attention to not only this day, but World Suicide Prevention Month of September. We walk around not generally understanding what a big problem suicide is in the country even before the pandemic. The last time we collected statistics was in 2018, and 48,000 people lost their lives to suicide. And as you point out, we really do have concern that it's going to get worse during this pandemic, and actually syndemic, because it's not just the infectious disease, but it's the economic crisis and the social upheaval. We don't have data yet that I have seen that really gives a good picture of that, but we definitely have data that show that depression is up, anxiety is up, substance use is up, and we expect that suicide will follow.
Oh my gosh, that's so sad. What are some signs of depression?
It's a great question, and for people to understand, first of all, everybody is stressed right now, so it's not as though we can just look for stress, right? So the signs of depression that make you worry, either in yourself or somebody around you, are things like major changes in behavior. Do people, stop eating, or they're not sleeping, or sleeping all the time, or not going to work, like a real change. Also, people might start talking about giving away things that are important to them. They might actually start talking about their thinking about death. And I really want people to understand that it never causes somebody to act on suicidal thoughts to ask them if they are thinking about suicide. It's absolutely the right thing to do if you're worried.
What if you're worried about someone and they don't want to get help for themselves? How should you go about that to try to help them?
It's another good question. There's a lot of barriers for people coming in. There's a lot of stigma, actually discrimination, but people feel embarrassed about it. First of all, I would let them know there is help. At Hartford Healthcare, we're definitely open for business. Our phones are open. Our locations are open. People are coming in. We're even still doing some video sessions for people that don't want to come in. So there is help. And people get better when they connect with treatment. They really do get better. One other thing that I would say is a trick, not really a trick, but a tactic, is to say to somebody that you're concerned about, I would hope that you would ask me the same question that I'm about to ask you, which is, are you okay?
Oh, that is wonderful advice. All right, and HHC, Hartford Healthcare, behavioralnetwork.org. Thank you so much, Doctor, for being with us and really just shedding a light on this. So important.
Thank you.
Thank you.
Take care.